One of the most challenging aspects of recovering from breast cancer can be feeling like a woman again, especially after a double mastectomy. But thanks to a special clinic at Eagle Ridge Hospital, women who are faced with this have a chance to gain their confidence back. Sandi Saunier is an areola tattoo specialist, and Carol Shields is a breast cancer survivor. They are both joining us now. Welcome.
Thank you so much for being here today. Now, I have to be totally honest, this is something I knew nothing about. I did a lot of research. So for me and the viewer, can you just explain a little bit about the clinic and what you do there?
What I do is basically tattooing like an actual tattoo artist. I tattoo areolas and nipples onto patients that have had breast reconstruction after they've had a mastectomy. Mm-hmm. So once the plastic surgeon has reconstructed the breast and they have a mound, then it basically will look like a Barbie doll or a mannequin until I get to do my job and put some coloring on the breast to make it look more natural and more normal.
Mm-hmm. And Carol, you've had this done.
I have.
Tell us what it's like once you have that. It's kind of, what did you say? It was the cherry on top, right?
No, the icing on the cake.
Icing on the cake.
Right,
Yes.
the icing on the cake. But what was the experience like for you?
It was amazing. After you have your surgery and you have your reconstruction, you do look like a mannequin. Mm-hmm. And when you meet Sandi, it's a whole wonderful experience. It's very natural. She spends time on the coloring, the size. I've learned so much about this whole procedure and about the time that Sandi donates to women like myself.
And Sandi, you are a trained nurse.
I am.
And then you moved into this, so it's sort of, I think it makes women feel at ease. And I also wanted to ask you about the alternatives. If people aren't going here, it's a plastic surgeon or is it a tattoo parlor? How does that work?
Well, up until the time I started doing this, I started a clinic in 2009. Mm-hmm. That's when I started doing my ladies, though that wasn't at Eagle Ridge. Mm-hmm. Starting in 2009, patients would either, some of the plastic surgeons would do the tattooing themselves, but they'll all admit that they do a really lousy job. Mm-hmm. Take them 10 minutes, it definitely wasn't a perfected process. And so they would either do it themselves or they'd send patients off to a tattoo artist or to a cosmetician. And that pricing would be anywhere from, I'm guessing, $400 to $1,200 to have this done. But they were finding that a lot of ladies didn't feel comfortable going to a tattoo artist, and obviously money was an issue. A lot of them have had to take time off work for their illness, had small children, whatever, and if you have that extra money, you're not going to spend it on yourself. So a lot of ladies weren't completing the process. Mm-hmm. So the plastic surgeons that I work with, as I'm a surgical nurse at the hospital, they asked me if I would be willing to start this program so ladies could get completed, and that's how it all began.
And then how did you train for it? What is there? You know, I'm sure there's no course. Or,
there's no course,
because you're using a
pioneer.
tattoo gun, right?
Mm-hmm. Exactly.
So how did you learn?
Well, being a surgical nurse, I wanted to have the cleanliness, that kind of a background. I know how to work with breast cancer patients. And so for the actual tattooing itself, I started researching to find out where is there another nurse that's ever done this. I found the only nurse that I could find was in Kentucky. And so she actually came up here and I lined up patients. She trained me. I also took a private course from a cosmetician, and I also hung out in the back alley of a tattoo artist in Abbotsford.
No way.
And he was extremely good too, lovely gentleman. Right. But I just tried to combine all that knowledge and start my own clinic, and wow. Since that time I've done 1,000 ladies.
Wow, incredible. Because it truly is an art, right? And you want to make it as realistic as possible.
Mm-hmm.
And
it is, yeah. It is. Mm-hmm. And I do spend a lot of time trying to match colors. If ladies just have one side done, if they want to bring their husband, sister, whoever, and they're allowed to have somebody else in for a second opinion.
Wow.
And at the same time, I think I get a sense of whether these ladies have completed the whole process, so that if I find that they still need help from the cancer connection, another plastic surgery referral, whatever, I try to feel out the ladies and how, if they've dealt with their cancer, and I can always send them the right direction if they do need help.
There must be a wait list for you.
There is.
Yeah.
Yeah, there definitely is. It's a few months long, but women, if I know somebody's going away and there's an urgency, I do my best to put ladies in as fast as I can.
Yeah.
Now, Carol, tell us, I mean, I want to know how does it feel to have it done once you're complete? What is the feeling knowing that you're done the process and
how Eagle Ridge Hospital Foundation's helped?
Exactly.
Well, it's amazing because I did have my surgery at Eagle Ridge, and I can't say enough about the hospital. They are absolutely wonderful from admitting to post-care. It's a very scary journey, but once you've had it done, you grow into accepting that you, A, have survived cancer, and B, you look somewhat normal. When you meet Sandi, then you feel complete. It's amazing, and I just can't say enough about her. The time she spends with your coloring, your feelings, your pretty much anything you want to talk about. It's just a nice way to end that journey.
Wow.
Thank you so much for sharing your stories. I can feel the bond between you two, and really, it really speaks to the program.
Yeah,
Thank you.
Appreciate everything you're doing, and like Bianca said, appreciate you sharing your story as well, so thanks.
Thank you.
If you want more information about Eagle Ridge Hospital Foundation's Areola Tattoo Clinic, you can go to their website. We'll be right back after the break.